Hello, my name is Ricky Weissman, instructor of the DGSA. In this video, I will introduce you to the basics of manual trigger point therapy, also known as the Swiss approach, which are used since the early 90s. Manual trigger point therapy is often an excellent and effectful addition to dry needling because you can treat the facial structures more specific. Studies have shown that both methods are effective. Therefore, manual trigger point therapy can be used in patients who cannot tolerate dry needling or where it is contraindicated. Check the indications and contraindications. You will find a separate video for that. The Swiss approach consists of 4 manual techniques. Technique 1, trigger point compression. Technique 2, manual stretching of the taut band. Technique 3, myofascial release. And Technique 4, intramuscular mobilization. In this video, I will show you the Technique 4, which is intermuscular mobilization on the upper trapezius muscle. The goal of this technique is to increase the intermuscular mobility, especially between antagonistic muscles as well as the elasticity of the fascia. This is important to improve the function of the muscle itself and to reduce muscular and facial adhesions. Bring your hand, respectively your fingers, between the muscles to be treated, like a wedge. For the upper trapezius, this is either between the upper trapezius and the levatoscapular muscle, or between the upper trapezius and the supraspinatus muscle. Combine Technique 4 with active movements. If you work between the upper trapezius and the levatoscapular muscle, then ask the patient to rotate the head to the same side. And if you work between the upper trapezius and the supraspinatus muscle, then ask the patient to elevate the arm. These movements help to bring your fingers deeper between neighboring muscles, and the mobilizing effect will be increased. As the treatment is painful, the patient must be able to interrupt the treatment at any time. However, it is important to mention that the pain during the treatment should be felt as a good pain. After having applied Technique 4, you often feel that the mobility of neighboring muscles increases and the patient's active range of motion improves. You will get the best result for Technique 4 if you follow these rules. Take enough time to place your fingers as gently as possible between the 2 muscles you're going to work. As long as the treatment is felt as a good pain, you can try to increase the pressure to bring your finger deeper between the adjacent muscles. The less tension of the skin you have in the beginning, the less painful it is for the patient. Although this is true for all 4 techniques, especially for Technique 4, make sure you have short fingernails. Note that there is no rule to always use manual trigger point techniques 1 to 4 in the same order. For example, if a restricted movement of a joint is in the main focus, it makes absolutely sense to start with the Technique 4. To complete your manual skills, check out the video tutorials for the other techniques of the Swiss approach. I'm Ricky Weissman. Thank you for watching, and don't forget to visit us on Facebook.